The increase in urbanization has been one of the biggest trends in the world over the last few decades. In 1950, only 30% of the world lived in urban areas. Since 2007, over half the world's population has lived in urban areas, and it is projected that two-thirds of the world's population will live in urban areas by 2050. In this video, we take a look at the correlation between a country's urban population as a percent of its total population versus a number of variables that correspond to health. Rising life expectancy is considered the best indicator of overall health improvement of a nation. Technological advancement, better sanitation, improved water, and easier access to healthcare facilities in urbanized countries all contribute to this rise. Although some developed countries have increased life expectancy to the desired level, other developing countries in places like the Middle East and North Africa are still struggling to increase life expectancy. The findings from research conducted by MRPA reveal that urbanization has a significant and positive influence on average life expectancy due to food availability in addition to better health services and facilities. Child mortality rates seem to have a negative correlation with urbanization. There tends to be lower child mortality rates in urban areas compared to rural areas because residents are better educated, have more regular incomes, and benefit from more accessible health facilities. Higher incomes in urban areas can lead to better chances of survival through purchase of food, medicines, and access to health care. Data in the World Fertility Survey indicated that early childhood mortality declined as maternal education increased, which is higher in urban areas. A case study of mortality in Senegal concluded that urban residents explain 58 to 72% of the variance in mortality rates. There is also a negative correlation with maternal mortality rates in urbanization. Urbanization presents a great opportunity for improving reproductive and maternal health and education. The availability of contraceptives, life-saving drugs, and necessary medical equipment is generally higher in urban areas. However, high levels of urbanization are likely to be associated with increased exclusion from care for many mothers in poor countries and continued high maternal mortality rates among the poor. Moreover, health and social services have not kept pace with urban population growth. Women in slum communities and on the peripheral parts of the city find it difficult to access care, even though a well-functioning health infrastructure is located nearby. An example of improved maternal care in urban areas is Bangladesh. Bangladesh has experienced a rapid decline in maternal mortality, with the maternal mortality ratio declining from 322 to 194 deaths per 100,000 live births between 2001 and 2010. Impressive improvement in maternal mortality has largely been facilitated by a government drive to scale up the national strategy for maternal health. Female healthcare utilization is lower in rural areas, and socioeconomic status is a primary determinant of access to maternal health care. Use of antenatal care from medically trained providers is higher in urban areas in Bangladesh. In 2010, 68% of the women in urban areas had access to antenatal care, compared to 49% in rural areas. Tuberculosis is a common bacterial lung disease listed as a top 10 cause of death by the WHO, and it killed 1.5 million people worldwide in 2018. The rate of TB decreases with increasing rates of urbanization. Data in 2007 portraits a pattern in which countries with higher rates of urbanization exhibit lower rates of tuberculosis illness than less urbanized countries. As of 2007, in sub-Saharan Africa and Asian countries where the urbanization rate is below 40%, TB existing cases per 100,000 people range from 200 to almost 800, whereas in most OECD countries, the TB existing rate is well below 200. Chronological data reveals the same trend. In the 17 years between 1990 and 2007, when its urbanization rate grew from 20% to 30%, India's TB existing rate dropped dramatically from over 600 per 100,000 to 200 per 100,000. Empirical studies have findings that could back up this trend. A less scattered population allows governments to concentrate limited medical resources to provide higher quality healthcare in cities. More urban population means more people have immediate access to such quality healthcare services. However, this requires a country to have adequate financial and technological resources to provide basic infrastructure and healthcare for its urban population. Otherwise, results will be like the cases of Ethiopia and Nigeria, where TB existing rates skyrocketed when the process of urbanization first began. Smoking is one of the leading causes of premature death in the world, and it tends to increase with urbanization. City characteristics and city life are significantly related to smoking and passive smoking. With greater life-related stress, urban people may seek to relieve this stress by smoking. In China, residents living in more developed cities with higher GDP per capita are less likely to smoke compared to those living in less developed cities. Higher one's socioeconomic status, the more health awareness they have, and the less likely they are to smoke. As we see in this graph, there is also a strong positive correlation between urbanization rates and the fat in blood for both men and women. High levels of fat in blood is a result of an overnourished diet and limited exercise due to urbanization. As people move from more rural to urban areas, the exercise from harvesting is traded in for taking a bus to purchase ready-to-eat food. Space for outdoor recreational activities also decreases due to increased population density, heavy traffic, and poor air quality. Interestingly, while developing countries such as China and Thailand show strong positive correlation, developed countries such as the US and Japan show fairly different trends, where as they get more urbanized, people tend to cut the fat, and this could be due to better education and nutrition. Overall, it seems that urbanization leads to better health outcomes. The mortality rates are lower, life expectancy is higher, and the prevalence of disease is lower. On the other hand, urbanization does lead to some negative consequences as well. Smoking rates tend to go up, and people develop more fat in their blood with less healthy lifestyles. However, with advanced healthcare and infrastructure in cities, the positives of urbanization seem to outweigh the negatives. People are expected to live longer and mortality rates are dropping, which indicates that urbanization has a positive effect on the health of people.